much.
Thank you, Mr. Chowdhury. It just goes to say that e-governance is a lot of e-health governance. And, you know, for the states who really adopt technology to see how can we really make a difference in the way healthcare is being delivered is showing results. And Punjab has been a true model and a great example. Thank you so much for sharing all that good work with us. Our next speaker will be the Health Secretary, Government of Andhra Pradesh, Mr. Jadu. He has been doing some phenomenal work even from the time he started, and he was full of questions about, what this whole conference is about. And I can tell you, ladies and gentlemen, that the state of Andhra Pradesh was probably one of the first in the country who even looked at IT to make a difference in the healthcare landscape. I know that a lot of the other states are catching up. And I'm sorry I made a mistake, IT Secretary and not Health Secretary. But sometimes, the borders merge so much that the responsibility is dual on you today. So thank you so much for taking some time off. Please join us and share your experiences, ideas, thoughts with this great audience. And he will be ready for question and answers immediately after the presentation, because there's another pressing engagement after he speaks to us. Thank you so much, and please join us.
A very good afternoon to you, ladies and gentlemen. Of course, I'm told that this is a session immediately after the lunch, so I can understand it will be very difficult for you to concentrate, and possibly slightly difficult for me to convey what I want to do. Friends, first and foremost, I'd like to welcome you to the city of Hyderabad. And to be honest with you, the topic ICT in health, again, very apt for Hyderabad, because I can tell you that Hyderabad is one of the most preferred destinations both for IT as well as health in the country now. And why in the country? I would say even internationally. What I'll try and do is try and give you a perspective into how health and information technology have kind of married each other. And as the IT Secretary, what's my understanding of the importance of information technology in health is? It's not a case study, it's more of a perspective that I would like to give to all of you. And I'm sure all of you come with this kind of a background, and many of these thoughts would be already known to you. But just to give you a perspective of how information technology has been playing and would play a huge role in improving the delivery of healthcare, at the same time the health services across the globe. Friends, to be very honest with you, I consider information technology as an absolutely sine qua non condition. It's an indispensable situation. I don't think we can run this world with the complexities that we have right now if we don't make use of information technology. I mean, gone are the days when we used to look at what would be the gains out of information technology. Because even if there are gains, even if there are disadvantages, there is no way we can live without information technology. I mean, you go to a hospital, you realize that half of the activities which are now being done are actually supported with the help of the information technology tools. Healthcare across villages, there are a whole lot of projects and programs. The colleague from Punjab presented to you what they have been doing in their state. In Andhra Pradesh, in our state, there are similar programs which are being run. and information technology has been playing a huge role. But I still have a feeling that there's a lot more that is possible. There's a lot more that can be done. And it would be conferences like this wherein we have the leaders from both industries, from the information technology industry as well as from the healthcare industry. When you sit together, share ideas, share notes, that the advances will get deeper, will benefit from each other, and possibly the world at large would benefit out of it. I don't really have a typical presentation, but I just wanted to kind of give you a brief perspective into what I look at when I look at ICT in medicine. Many of these things are known to you, but I'll just try to give you a full perspective into what are the possibilities in this particular sector. There are, as I mentioned, there are advantages and disadvantages. I would not like to go into the disadvantages because to my mind, as I said, it's indispensable. There is no way you can run the world if you don't make use of information and communications technologies. In the end, I'll also like to give you a bit of a perspective about the differently abled people and how information technology can play a huge role in bringing in and improving the lives of the differently abled and their health conditions. Friends, I've just tried to put a bit of a perspective here. Where all ICT is being used right now in medicine, what are the sectors, what are the possibilities? Broadly speaking, we are all aware about the communications part. I mean, how do you make a computer in a hospital talk to the other computer? How do you make a computer in a hospital talk to other computer in some other hospital in some part of the world where data sharing takes place? I think that's where communications play a huge role. Look at the patient records. I mean, now even in India we have computerized patient records in most of the hospitals. I mean, you don't need to carry a file because all that is available in the database in the hospitals. Yes, in the rural areas still, the primary health centers, the tertiary hospitals, the district hospitals that we have, huge possibilities are there. And that's where the friends from the ICT industry, I'd like to exhort them. I mean, this is one sector, this is one area where possibly immense business opportunities exist for the ICT industry. And on the other hand, it gives it can play a huge role in improving the health management of millions of citizens who live in rural areas in our country. Medical equipments. I mean, any equipment that you use now, there is an ICT component. Be it in the form of a small microprocessor inside it, or a communication device which makes it talk to some other device, or the display monitors, or the robotic arms. I mean, there's a whole gamut, the whole range of equipments which have an inbuilt ICT component. We have also reached a stage where now we are talking in terms of expert systems, these knowledge-based systems. I mean, where knowledge is being transferred from one mind into another, making use of information and communications technology. It's not essential that the individual who has to take the decision should have all the knowledge. That can be in a repository, and that repository can transmit that knowledge to the person who needs it. Information technology is playing a huge role even in the web-based diagnosis. Of course, it has its own disadvantages. In fact, my doctor really advises me, the moment I have a problem, he has clearly told me, don't Google that problem and come to me. Because if you Google a problem, you'll come up with absolutely outlandish ideas of what you have. I had a bit of a headache and immediately I started thinking in terms of a brain tumor. So he said, don't go around and Google and try and figure out what the problems you have. But still I feel many of the doctors make use of web and the internet to know what's happening around. to look at the research findings, to look at papers, to evaluate, to diagnose, to work out the management plan. So information technology has opened up huge vistas in terms of knowledge frontiers for hospitals and doctors. And then research. I was in Harvard and a couple of months back, and I met one Nobel laureate, and he told me that, the research in genome wouldn't have been possible without information technology. This whole decoding of the human genome wouldn't have been possible if there were no supercomputers around. And he said, he's a doctor, but he said that I've been trained as a doctor, but then I realized that I cannot pursue my research unless I have qualifications in information technology. And then from there he went to Stanford and did his master's in computer science. And he told me a very important area which is a marriage between biology and computer science. And stuff like computational biology and things like that. So he said, the present cutting edge research in medicine is coming in from this marriage between the information technology and biology and medicine. So ICT has huge role, and I don't know what are the global spends. When you look at the overall scenario of the ICT spend globally, I would possibly think that ICT in medicine might be the leader, much more than ICT in finance, which world at large knows. But I think ICT in medicine is possibly the next biggest frontier as far as the next 20 to 25 years of global growth is concerned.